Hi everybody, this is Dr. Bachman at Austin Spine and Sport, and today we're going to talk about tennis elbow and self-treatment. So we see this condition quite often. It's classified as an overuse or repetitive stress injury, and classically lateral epicondylitis, which is the clinical name for tennis elbow, or medial epicondylitis, pain of the inside of the elbow, also known as golfer's elbow, are caused by the same kind of causes. Basically, you asking your elbow to do some work that it is unable to do, therefore it fails on some level. And each of these conditions are famous for lingering, for becoming nagging injuries that just don't respond to treatment or repeatedly come back and bother you. So we're going to go over self-treatment using the flex bar, which is a very effective treatment method. And it's a little tricky as how to set up for this treatment. It's an it's an eccentric wrist extensor or flexor exercise. So if you have lateral elbow pain on the outside, you're going to start holding the flex bar. By the way, I have a link at the end of the video. These are about 17, 18 bucks. Start holding the flex bar in your affected hand, the side of the side that hurts. Grab it like this, and keeping your grip, bring it down to a comfortable level about your waist. And then you're going to release that twist over 4 seconds. And then crank down on it like you're twisting the throttle on a motorcycle. Release over 4 seconds. You're going to feel this the outside of the elbow. You're going to feel these muscles working. And the protocol is 3 sets of 15 daily for 6 weeks. And somewhere around 75 to 80% of patients who do this technique see dramatic results. So to treat medial epicondylitis or golfer's elbow, you just reverse it. So the affected hand holds the bar facing down. Grab this way, keeping your grip lower here, and then crank on the gas of the motorcycle for 4 seconds. And reload, 4 seconds on, reload, 4 seconds. And if you need any additional information, I've attached a link at the end of the video for how to purchase this flex bar, also for the protocol and photos. So hope you guys have a great day. See you later.
손가락을 뒤로 쫙 작게 올리세요. 자, 버티십시오. 네, 다시 빼시고, 자, 버티십시오. 자, 네, 됐습니다. 다시 한 번 더 끼십시오. 네, 됐습니다. 네.
Welcome to the Trigenics Total Wellness Clinic. I'm going to just let you know all about what you're in for here today. And if you just come on in and follow me, we'll have a little chat. Basically, at the Trigenics Total Wellness Clinic, we do things a little bit differently. When you come in here as a patient, I'm going to be looking at you, and not just looking at the body signals or the symptoms that you come in with, but I'm going to be looking at you from top to bottom. We're going to do a structural assessment because your entire body is connected. The ankle bone's connected to the knee bone's connected to the hip bone, and so on. And in the Trigenics clinic, what we do is we will assess you structurally, and we'll basically be able to tell from that assessment where the weak links are in your body that may have contributed to or caused the condition that you're suffering from. With Trigenics, it is a different approach to care. You're probably coming here because you have some type of musculoskeletal condition, which means you probably have an ache or a pain somewhere in your body, and it's been bothering you for a long time, and quite possibly, as with most of the patients that come here, you'll have been many other routes to try to receive help. You'll have seen many other types of doctors or therapists, and you'll have ended up here having heard that we have something that's quite different and that's very, very effective in alleviating those types of conditions. So what we're going to be doing essentially involves balancing your body structurally and functionally, because structure relates to function. Basically, let's take it back a step and let's talk about how particular conditions in the body often develop. Most of the conditions that are resulting in some type of pain syndrome are due to a muscular imbalance that develops around the joints or the areas that are moving in your body. When a muscle becomes damaged, injured, or stressed, what happens is the sensors inside the muscle that are always sending signals to the brain, in order for the brain to be able to know what's going on and in order for it to be able to coordinate movement, those sensors stop working properly. And when that happens, the brain gets a little mixed up. It doesn't get the right messages. And as a result of that, what ends up happening is the brain starts to send either too many signals or not enough signals back to the muscle that's been involved. If it sends too many signals, the muscle becomes short, and it stays that way. No amount of stretching exercises will ever keep it elongated, because the nerve messages, there's too many going there, and the muscle will go back to its shortened state. So you won't be able to correct it with just stretching exercises. If the brain sends not enough signals down, the muscle will become weak, and that's called neurological inhibition. Actually, all of this is called neurological inhibition. And when that occurs, and the muscle is neurologically weak, no amount of strengthening exercise, weightlifting, or any of that will actually enable the muscle to regain its normal strength. And the other thing that happens is, if one of the muscles happens to be weak in your body, the other muscles that try to do the same movement will overcompensate, and those muscles will also start sending the wrong signals, and an entire imbalance pattern will develop throughout what we refer to as the kinetic chain in your body, which is the chain of muscles. They're all attached to the joints and the different areas of your body, and eventually what happens is significant weak links are developed in that chain in certain areas. You could have a problem in your shoulder that actually causes problems in the wrist to appear, for instance, or a problem in your lower back that causes problems in your knees, your hips, or you could have feet. 97% of the population have flattening of the feet because we've been wearing shoes for years, and if one is even 3 millimeters more than the other, that can cause a bit of a scoliosis or curvature to develop in the spine. And so what we do with Trigenics is we incorporate using your nerve reflexes. We use reflex neurology with a type of biofeedback breathing, where you'll be breathing a specific way, and we'll also at the same time apply a type of manipulation to the sensors inside the muscles. And when we combine those three things, which is why it's called Trigenics, it has a very dramatic effect on your nervous system. And essentially what ends up happening is we kind of reset the computer. We reset the way that the brain is reading those signals, and the brain ends up sending the proper signals back to those muscles, restoring the strength and restoring the length of those muscles. And that, in essence, restores the proper function to the joints, and the joints don't deteriorate, and it also alleviates the stress or the irritation to the nerves that are crying out and saying, I'm hurting. And so the result is a significant decrease in pain, which is quite immediate, a significant increase in strength or length of the muscle, and a return to function. If you don't get this type of treatment, all of the massage or what we call soft tissue treatment techniques, or even manipulative techniques, or all the different types of manual medicines or physiotherapeutic modalities like ultrasound and all of these things, none of that will actually really correct the underlying problem. It may help to alleviate the symptoms, like an ultrasound machine will reduce the swelling, which will reduce some of the pain, but it won't correct the problem. So what has to happen is the first thing that needs to be corrected is what we call aberrant neurology. That neurological inhibition that we were talking about needs to be corrected, and the proper communication between the brain and the body needs to be restored. With Trigenics, that's what we do, and that's what will be happening with you here today. In the very first treatment, Trigenics is usually effective in alleviating pain and restoring motion and function and strength. So in the very first treatment, you should feel some results for the most part. Now, at the clinic here today, you're going to undergo a very thorough examination. As I said, we check you from top to bottom, and one of the doctors here, either myself or one of the other doctors that work here, is going to ask you a lot of questions about your condition and do what we refer to as a history. And following that history, he's going to do a muscle testing examination, where he's going to be actually testing all those muscles for strength or length inadequacies. And he's going to be drawing what we refer to as a functional map of your body. And then from there, he's going to be using either the Trigenic strengthening, neurological strengthening procedures, or he's going to be using, or he or she is going to be using the Trigenics lengthening procedures. And this will help restore the normal balance amount. And at the end of the day, what that does is it enables any other form of treatment to actually be effective. And what, as a chiropractor, and I am a chiropractic physician, I'm also a certified chiropractic sports physician, a certified chiropractic rehabilitation doctor, and as a chiropractor, we'll be looking to also mobilize the joints once we restore the normal muscle function and nerve function, because those joints may become jammed up as a result of that muscular imbalance that's been there for some time. And when the joints become jammed up and stop moving properly, especially if they're in the spine, they can actually irritate the nerves that come out from between the bones and cause a lot of pain to develop in the back. So we're going to be doing that today. We're going to be examining you today. We're going to be doing a very thorough assessment. And hopefully, at the end of the day, you will join the ranks of the many patients that have come here and experienced immediate results with Trigenics Myoneuromedicine. Thank you.
All right, now I want to deal with your shoulder pain. Here's what we would do with shoulder pain. I'm going to take 2 electrodes. I'm just going to presume on this one we're using a 10 unit. This is a 2x2. If we were using interferential, we would use a 3-inch round 3x3. If I'm having pain in my shoulder, I may take one, let's say the pain's coming here. I may take one electrode, put it here. I may take the other electrode and put it on the opposite side. So I'd have one here. Electricity comes on, goes across, my pain's right in here in the joint area. Now, next thing I'm going to do is I'm going to take another electrode, put it here, put another one right up here. Now, what I'm looking for, so you understand, I really don't want to be near a bony prominence. The reason I don't want to be near the bone on your shoulder is there's less fluid there. Muscle tissue has a lot of fluid. That means it can conduct electricity. But what I'm doing is I'm targeting the pain in your shoulder. Boom. goes electrical energy, and across. The target is your shoulder. That would be a great electrode placement. Now you can look at our other video about touching or palpating that will actually help you determine exactly where's the best place to go. But this is a great example of one type of electrode placement for shoulder pain. Thanks for watching.